Hi, I'm Joe Chili. Mornings from 7 to 9 on Buffalo's oldie station, the Big Wack. Joining us on the Big Wack's Buffalo on the Rise today is Dr. Christian Miliotto from WNY Pain Relief. How you doing?
I'm fabulous.
Yeah.
I've been saying that all day today.
Yeah, fabulous. You're just trying to convince yourself?
No, everybody asks me how I'm doing. I'm always doing good.
Really?
That's I'm always doing good.
All right, well, the weather has finally changed. I think at the time of this show, the weather is nice. But what kind of changes are we experiencing, when people are, they're outside now, they're gardening, oh gosh, and, the next day after gardening, oh, my back is killing me. Or they're carrying mulch. I saw somebody the other day carrying those big bags of mulch. They had like 16 or 20 of them like this. And I'm thinking, what do you feel like the next day after that? That's when they should be calling you, right?
Yeah, it's funny because I was driving home from work the other day, and my neighborhood's pretty cool. Everyone's really nice. And I'm driving past this one house on the left, and they have a pile, like probably about 500-600 pounds of stone. And this old guy is shoveling the stone into a wheelbarrow. And I'm sitting there thinking to myself, he's probably going to be calling me in a week. This is the time of year where we want to go outside. We want to be more active. We want to do gardening. We want to go and do our landscaping and yard work, mow our lawns. But this is also the time where people start to become more conscious of some of the pain and the inflammation that they're getting. And those are the warning signs when, you want to be proactive about something. A lot of my patients that have been coming in recently, their consultations, the number one thing they say is, I'm going on vacation. Summer's about to come. I want to treat this so that I can enjoy my summer. I can get better faster. And yeah, this is the time where you want to address something.
When people go out and work on things, they're lifting things like that, you see somebody wearing like these vests or these belts, around there. Does something like that work?
Well,
you look on your face.
Well, I'll answer it with a very specific case study. Home Depot did a study on people because a lot of their employees were getting work-related injuries.
Okay.
So what they decided to do was give all the employees back braces, because they assumed that if we give them back braces and it gives them support for their back, then they will be able to do their jobs, bending, twisting, lifting, and they won't get hurt. Well, down the road, what actually happened very quickly was there was a significant increase in work-related injuries. And that's because if you're wearing a belt around your back to support your spine, you're destabilizing your core. So your core actually weakens over time. So you really shouldn't wear something like a back brace unless you're using it for short spurts and for a specific activity, and then you take it off. If you wear it all day, every day, it's going to make your condition worsen over time.
I used to hear all the time, lift with your legs.
Yes.
That's legit?
Oh, 100% legit. Try bending over with your legs straight to pick something up, and then do the same thing. Don't do it, guys. And then do the same thing bending. Bending from your knees and engaging your core and your waist to pick something up is significantly more efficient, and you're not putting that dynamic stress on your back. You don't want to be flexing forward with your legs straight out and not utilizing your natural biomechanics. For example, when we work with people, we're a very complex and research-based clinic, but I make things very simple for my patients. When you come in for a consultation, I want to look at everything that's going on. Do you have back pain? Do you have nerve issues? Do you have neuropathy? Do you have shoulder pain or hip pain or knee pain? And these are all things in our body that traditionally when people are treating them and they're not successful, it's because PT failed, chiropractic failed. You started doing corticosteroid injections or epidurals, which are very dangerous to the body, and nobody ever explains, the doctors never explain that this actually makes the tissue in your area break down faster. The arthritis get worse, the disc herniation get worse. And we customize treatments to actually create regenerative healing in the tissue. And a lot of people don't know that, these things exist. And what I simply did, because I don't think I'm anything special, is I spent the time to research and niche myself into anything related to the body. So I can work on neuropathy, back pain, disc herniation, sciatica. I had a patient, really nice guy, Dan, if you're watching, I love you. He had severe back pain, phantom limb pain from getting his leg amputated, from diabetic neuropathy, and he's a firefighter. So imagine your quality of life when that happens. Not only do we eliminate the phantom limb pain in his leg, but when he came to us, he was in a wheelchair. By the end of his 3 months of treatment, on his reeval, he walked into my office with nothing. No cane, no wheelchair, no support. His physical therapist that he's working with is mind blown because he's walking hundreds of yards without any pain. You know, that's what we can do for people. And all I want to do is help as many people as I can avoid the medical route if it's related to drugs, injections, or surgical intervention when it doesn't have to happen. And
with summer coming, this is the time you want to do it. And let me ask you, we only have a couple of seconds left, but if you wake up with a crick in your neck, you know, should people call you, or does that go away on its own?
If you have any type of acute or chronic pain and it's related to a bone, joint, or muscle in your body, be smart, have it assessed properly, make sure you get the right imaging, come to one of my educational seminars, come in for my free evaluation. You will learn more in my office with me in 1 hour consultation than the last 10 years of things that you've done. And I promise you that. I hear it all the time. Don't wait until something gets to the level where you can't function and you're thinking about going into the emergency room.
And you notice how well versed I am in this, using that medical term, crick in your neck. All right, Dr. Christian Miliotto, thanks so much. For more information and answers to your questions, contact WNY Pain Relief by calling 716-650-PAIN or go to buffalopainrelief.com. Sponsorship and promotional considerations for the preceding segment was provided by Western New York Pain Relief. And don't forget to join me weekday morning, 7 to 9 a.m. on The Big Weck.